Those of you who don't know me, I'm Chris McBride. In my current life, I am the Executive Director of Spinal Cord Injury BC, which many of you will know by our former name, which was the BC Paraplegic Association. In my previous life, I was actually a spinal cord injury researcher and was Managing Director here at ICORD, and I'm very honored to be asked to come and facilitate this session tonight, which is the Café Scientifique, which is a great program hosted by or sponsored by the Canadian Institutes of Health Research. And it's really intended to bring the broader community together with research to exchange knowledge, to discuss ideas, and to have an interaction between you all. So I hope that you all embrace that tonight. And there will be a point later on tonight when we are going to pass a microphone around. There's notepads there and pens. You can write down questions and give them to Jacqueline here, who will collect them, and we can ask them a little later on. So there's lots of different ways that you can do that and participate. So the title of tonight's cafe is Paralympic Wheelchair Athletes, Struggles Behind the Gold. And we have an expert panel here with us today to discuss that. On the far right here is, my far right, Dr. Chris West, a postdoctoral fellow here at ICORD. The famous Dr. Andrei Krassioukov, who is a professor of Physical Medicine and Rehabilitation, UBC's Department of Medicine. He's also a principal investigator at ICORD and a staff physician in the Spinal Cord Injury Program at GF Strong's Rehabilitation Center. And then we have Dr. Jaimie Borisoff, who is a new Canada Research Chair in Rehabilitation Engineering Design at the British Columbia Institute of Technology, and a principal investigator here at ICORD. But Jaimie's also a multiple medal-winning Paralympic athlete. He's won gold in Athens and Sydney, and he's won silver in Beijing. And I guess we still don't talk about Atlanta, because that wasn't on my notes. Yeah. So each of our panelists will give a little talk, a little presentation. We'll take a break, during which you can go get a drink, have some refreshments. You can take time to chat with some of the researchers that are here, with the panelists, and then we'll come back and we'll have a discussion period. But before we begin, I just want to say a couple things. Arnold up here on the ramp is live tweeting the event, and I've been told if anybody else wants to live tweet the event, you should do that. And there's a hashtag for tonight, which is Struggle for Gold, and I think that's on your table. So if you do some live tweeting, I'll be probably pulling out my iPhone once in a while. It's not because I'm bored; it's because I'll be live tweeting myself or renewing my parking or something like that. But, one more thing before we get started, and we have a special presentation for the ICORD research team here that was fortunate enough to travel to London and perform some research at the 2012 Paralympic Games in London. And for this presentation, I'm going to hand the mic over to Dr. Howard Feldman, who's the Executive Associate Dean of Research at UBC's Faculty of Medicine. Dr. Feldman.
Thank you very much. Good evening, everyone. It's my pleasure to be here and honored to actually distribute some medals to the research team that Dr. Krassioukov led at the London Paralympic Games. So a very nice occasion and one of the truly enjoyable functions that I get to perform in my role. As we approach this evening's presentations, it's worth thinking about the qualities of great research and the value that they create. Research requires imagination, curiosity, creativity. So those are the more glamorous and idealistic sides of research. The side that you may not think about is the grit, the determination, and the extraordinary perseverance that goes along with research. Dr. Krassioukov explained to me that for the London Paralympic Games, the funding model that was used to support the research team to go to London and to be present to do their studies involved fundraising locally, involved scraping and scrimping to be able to put together the funding that was needed. So it's truly a tribute that they were successful with this degree of grit and determination to get to London and to accomplish the great work that they did. So we're going to give this team some commemorative medals These are with some certificates that go along with them. These were signed by Sir Philip Craven, President of the International Paralympic Committee. It acknowledges the value of clinical research performed by Dr. Krassioukov and his team at the 2012 London Paralympic Games. During these games, this team put together a cardiovascular health clinic that was approved by the International Paralympic Committee at the Athletes' Village. This was a 5-member team that ran this clinic from August 29th to September 9th. The purpose of their clinic was to provide the athletes with evidence-based clinical knowledge, so the highest level of information that we have as clinician scientists is evidence-based, where there's a good solid basis by which we inform people, and at the same time obtain crucial practical information about cardiovascular health of the athletes during their training and competition of those with spinal cord injury. Now contextually, and I won't steal the thunder of what you're going to hear this evening, but why is this important? And it really centers around this unique problem that occurs in the aftermath of spinal cord injury, where people get tremendous instability of blood pressure, where blood pressure may run from being very low to very high, all in a moment or with a particular stimulus. At the very high levels, one runs the risk of heart attack and stroke, so it can be a very dangerous situation. And at the lowest levels, people feel quite unwell, as if you're about to potentially faint. So these are swings that occur in the context of spinal cord disease, and Dr. Krassioukov and team have really been investigating this with the hope that they can provide information that's truly meaningful to affected individuals to try and improve their lives. So this is very important research that they'll be sharing, and I want to conclude these remarks by presenting the team with these awards and certificates. So the first is to, it's like the Academy Awards, Melissa Pack. Sure. Christopher West. Jacqueline Craig. Andrei Krassioukov. Is not here this evening.
He's studying.
He's studying. So, team, on behalf of the London Paralympic Games.
I'm the moderator. So thank you, Dr. Feldman, and congratulations to all of you. If I'd known that you could get like a medal for doing research, I might have stayed in a little longer. Anyways, our first speaker is Dr. Krassioukov himself, known to many of us as Dr. K. He's a true pioneer in the field of autonomic function and dysfunction in individuals with spinal cord. Man in the field, Dr. Krassioukov.
Good evening, everybody. Thank you, Dr. Feldman. Thank you, Dr. McBride. It's a great pleasure to have our second Café Scientifique in this building, and nobody can hear me.
No one can see you from there.
Oh. And really great pleasure to report you what's happened with our cardiovascular clinic in London. I have only 10 minutes to describe you this exciting 10 days, exciting and challenging 10 days, and I have to tell you that it is our third Paralympic Games that my team worked with very exciting team of people. Paralympic athletes are amazing, hardworking, and really, really exceptional people to work and observe. Citius, Altius, and Fortius. This is a model of Olympic and Paralympic Games. Faster, higher, and stronger. But what is actually behind this very interesting and colorful words? We're expecting that Paralympic athletes are healthy, powerful, they endorphin-driven, they are enjoyed and thrilled to win. But it's not always so joyful and powerful. There is also pain and aches, as we know. We always know we're going to the gym and we're coming from the gym even with the pain, right? Paralympic athletes are pushing themselves extremely hard in order to win. And that's why what we try to look during our cardiovascular clinic, what we can do with respect of our research, how we can bring some knowledge that we learn and obtain in a laboratory environment to prevent some of the unfortunate events with respect of cardiovascular health that could be helpful to Paralympic athletes during competition, during the training. And there were obviously joyful moments. This is one of the pictures which we made just after the finishing the gold medal game with our basketball wheelchair team. And this is Peter Richard, one of our Paralympic athletes with his wife. It was fantastic. And of course, this is me during one of his former games, also our Paralympic athletes. That's the goal of our clinic, as you heard already. First of all, main idea was education about possible cardiovascular health issues of Paralympic athletes. And then obviously, where we were able, we collected some research data, and I will leave presentation about research to my junior colleague, Dr. West. But what initiated idea about the cardiovascular health clinic? The knowledge that during the last 10 years of research, we learned that individuals with spinal cord injury are susceptible to very high morbidity.
You need to stand this side. You're blocking the light. Can you stand?
I don't see it.
That's better.
We learned that during the last 10 years, people with spinal cord injuries become very susceptible to cardiovascular morbidity and mortality. We learned that individuals with spinal cord injury are dying and developing cardiovascular disease much earlier and at much higher rate than people, able-bodied individuals. And this is obviously very alarming. Oh, wrong way. That's what we do know about exercise in able-bodied individuals. Exercise will increase heart rate, and it's normal. They will increase blood pressure. They will increase peripheral blood flow in order to provide good supply of oxygen to the musculature. They obviously will increase respiration. And this all required for our body to prepare for exercise, to adjust to exercise, all in order to compete for our body to perform better. What's happening in a person with spinal cord injury? Not everything working so well. First of all, arterial blood pressure in a person with spinal cord injury, as Dr. Feldman already mentioned, sometimes is extremely low. And do you know how you feel when your arterial blood pressure is very low? We're tired, we are fatigued, we're running to the Starbucks to grab this cup of coffee. In person, able-bodied person, cup of coffee is very helpful. Unfortunately, for a person with spinal cord injury, cup of coffee will not help to increase arterial blood pressure. It still will be extremely low. There is also presence of orthostatic hypotension, condition when you sit up or stand up, your blood pressure going extremely low, down. and person become dizzy, lightheaded, or even can lose consciousness. Extremely low arterial blood pressure. There is also when you're trying to exercise in order to become healthy and feel better, your arterial blood pressure can go even further down to your boots. It's also not very good. There is also not ability to improve your heart rate response to exercises. What I told you, in able-bodied individuals, heart rate could go up, and it's supposed to be improve your health. In person with spinal cord injury, heart rate cannot go very frequently up in order to provide better cardiovascular response to exercise. It can sometimes stay very low. Then there is also episodes of opposite response in blood pressure, episodes of autonomic dysreflexia. And some of you who is working in ICORD knows that my research in laboratory in hospital is very, very I'm always very interested in this research about autonomic dysreflexia, episodes of hypertension. And these episodes of episodic hypertension are extremely dangerous for people with spinal cord injury. That's why in addition to low blood pressure, sometimes people with spinal cord injury could respond this with aberrant, abnormal episodes of very high and life-threatening episodes of high blood pressure. Therefore, as a result, people with spinal cord injury have this constant imbalance, low blood pressure, high blood pressure. Plus, some of the people with spinal cord injury who do realize that I'm so fatigued and tired, I would love to increase my arterial blood pressure to at least normal level. And that's what we call boosting phenomenon. And everybody sometimes before Paralympic Games will ask me, tell us about boosting, what's happening in boosting. And boosting in a sport, and particularly by International Paralympic Committee, is prohibited as a possibility to use. We have to keep it in mind. Because it is life-threatening. Because by boosting, person can increase arterial blood pressure to the level that could be harmful for the person with spinal cord injury. Clinically, we do know that episode of autonomic dysreflexia or uncontrolled boosting could result in a death. Paralympic Games, summer, winter, variety of sport, variety of classification, variety of challenges. How I'm starting it. Some of you who are not familiar, please watch this small clip. This is a rugby. Interesting, right? A lot of exercise, a lot of challenges, a lot of power, a lot of endorphins. That's why in order to perform all these activities, you need all your muscles, all your blood pressure, all your heart rate. But if you don't have some regulation, some activities, you will be not able to perform very well. That's what our team done during the numerous Paralympic Games, and this is what you see our team. We have some visitors in our clinics. This is a team visited by IPC members, and during the Winter Paralympic Games, Prince Edward visited us. During the London Paralympic Games, we were able to examine 14 Paralympic athletes from 14 countries around the world. We had 64 Paralympic athletes visited our clinic. Sometimes we work 10 hours per day. We sometimes close clinic at 10:30 p.m. We were tired, we were exhausted, but we were happy. Yes? I believe we were. What did we learn? One of the aspects what we collected, we talked with people, with Paralympic athletes about their blood pressure, about heart rate, but we also some collected interesting data. For example, we used recently introduced in clinic autonomic international standards that were actually developed with my support and presently used around the world. And what we learned is that about 50% of Paralympic athletes actually have no idea what is their blood pressure. They actually did not remember when their last blood pressure was measured. And about 50% were not aware what is autonomic dysreflexia. And we're talking about life-threatening condition. We're talking about blood pressure, which, for example, every single patient who we discharged, for example, from G.F. Strong Hospital here in Vancouver, will receive recommendation, you have to have blood pressure machine at home. Or you have to have even medication that could prevent you from developing autonomic dysreflexia. What are the possible implications of not knowing what's happening with your arterial blood pressure? For example, there was a very well and interestingly conducted study by International Paralympic Committee, and actually first author is our Canadian scientist, Dr. Bambani from Alberta. And this study conducted in 2008 in Beijing demonstrated that when Paralympic athletes were asked how frequently and who of you can perform boosting, intentionally induced autonomic dysreflexia, it was an anonymous study. 70% Paralympic athletes in Beijing answered that they do use boosting in order to improve their performance. It was an anonymous study. When we analyzed our data using our sample of athletes from Winter Paralympic Games, and our sample was very small at the time, it was only 27 athletes, we calculated that athletes who has abnormal cardiovascular function, who were predisposed to develop orthostatic hypertension and therefore possibly could use boosting, we estimated that percentage was a little bit high, about 40%. And then when we analyzed data from London, we have 64 Paralympic athletes, and our data estimation showing that about 60% had severe cardiovascular dysfunctions, and these athletes probably were predisposed for participability for boosting. I'm not talking that they will use boosting, but they were predisposed for use boosting as possibility to improve performance. That's what we are standing right now with boosting. In a sport, boosting is deemed illegal by IPC because of harming effect on the health of Paralympic athletes. However, in a clinical situation, I'm as a physician working on a daily basis with patients with spinal cord injury. We do know that up to 74% of people who are admitted in a hospital environment will be not able to participate in rehabilitation if we will not adjust their blood pressure, if we will not boost them. I'm using boost. If we will not put abdominal binder, if we will not prescribe a special medications which will increase the arterial blood pressure to a little bit higher level. That's why, in a way, in a clinical environment, we do using some medically appropriate, medically tested devices in order to boost the arterial blood pressure, in order for them to perform in rehabilitation better. That's why here is disconnect between the sport events and clinical environment. That's what I would like you to take home today from this, my talk. We are working closely with IPC, and we fully support the goal of elimination boosting from the practice of Paralympic athletes because it's a possibility of harmful effect for their health. However, I am as a clinician cannot see how we can punish of individual with spinal cord injury who is planning to participate in a sport or activities, who is trying to improve his or her blood pressure to the normal level. I don't feel that this is a cheating. Education is one of the, I believe, crucial component in this, I believe, issues. And I believe goal of my team and myself to work closely with IPC with Federation of Rugby, Federation of Basketball, that we have to find solution how we have to solve this mystery. I have to acknowledge, where's my slide? Yes. No, where's my slide? Slide was lost. We have to acknowledge the supporters. Jackie, where's my last slide? No, there was a slide lost. No. I have to acknowledge the supporters, Craig Nielsen Foundation, and people who supported our, those were still slide missing. Without the support of Craig Nielsen, the educational clinic will be not possible. Supporters who came and supported us at the fundraising campaign, Ed Milligan and his company who donated money for our uniform of my team, and many, many other people who supported personally for fundraising, and ICORD who donated money to conduct research. And at the end of the talk of